and it's doing its thing.
All right. Okay.
I didn't set the co-host.
Okay.
I'll do that.
You can do that while we're doing this. Good afternoon, everybody. This is the Public Health Minority Health Disparities Subcommittee, and we're going to be doing a work session over several bills. I'm just double checking. Okay, we're going to let everybody in. And I'm going to go through the bill order. We're going to do House Bill 272, Food Establishments, Laboratory Requirements, and On-Farm Food Service Facility License. Then we're going to do House Bill 276, State Emergency Medical Services Board, Public Access Automated External Defibrillator Program Revisions. Then we're going to do House Bill 427, Task Force on Responsible Use of Natural Psychedelic Substances. Then we'll do House Bill 181, Restaurants Disclosure of Main Food Allergies. House Bill 316, Confidentiality of Medical Records, Definition of Medical Records. And House Bill 410, Food and Milk Product Labeling Requirements. And expectation is that most of the bills we will probably be discussing to figure out where the members are on these bills and what concerns there are, so that we can give some direction to the bill sponsors and hear, what the stakeholders may have issues with. But we think that we may be able to vote on at least one bill today. So let me go ahead and open with House Bill 272. And I'm going to ask Lindsay Rowe, who is counsel on this bill or analyst on this bill, to present the bill.
Thank you, Madam Chair. This departmental bill alters the definition, duration, and license fee for an on-farm food service facility. The license fee must be determined by the Department of Health based on the anticipated cost of licensing, regulating, and inspecting licensees and cannot exceed $100. A license is valid for 1 year unless renewed. The bill outlines requirements for the adoption of regulations related to on-farm food service facilities. The bill also expands the type of portable toilets that can be used in conjunction with food service related to agritourism. The bill's provisions relating to the portable toilets take effect July 1st, 2026, and then the provisions relating to on-farm food service facility licenses take effect January 31st, 2027. Maybe an hour ago, I sent out amendments from the Department of Health that were agreed to with MACO. The original MACO testimony on this bill requested elimination of the $100 fee cap, adding language specifying that the bill doesn't supersede local zoning or land use, specifying that the bill doesn't authorize MDH to conduct or require a land value assessment, and requiring MDH to consult with stakeholders and locals when developing their regulations. So MDH adopted all of those except for the elimination of the $100 fee cap in the amendments that I circulated. And MDH is here, as well as I see folks from MACO.
All right, so I'm going to ask MDH to discuss the amendments and particularly why they did not want to eliminate the cap. We had a great deal of testimony from local jurisdictions about why they thought they needed the flexibility to make sure that they could cover the cost and needed that flexibility on the fee. So who's here from from the department on this departmental bill?
Morning, Chair. This is Megan Lynch.
Good
morning.
morning.
And I'm Dr. Clifford Mitchell.
All right, good morning.
Good morning. I think the department was very happy to accept the amendments from MACO. We agreed with them entirely with respect to clarifying the issues related to assessment, related to consultation with local health departments and local representatives when developing regulations, which all along.
I'm sorry, can you get a little closer because you're...
Oh, sorry.
Okay.
Is that better?
Maybe you can switch seats.
Yep.
If I may, I think the Zoom she just muted it. Okay, that should help.
That should help. Okay,
Thank you very much. Can you hear me now, Madam Chair?
that's much better.
All right, sorry. So as I said, we were delighted to accept the amendments related to clarifications and improvements in the bill that MACO offered. Our concern with the fee cap had to do with the governor's broader agenda to try to limit fee increases wherever possible and to ensure that there was no barrier to accessing this license for farms across the state, including small farms.
All right, so let me ask, what is your response to the concerns that the local jurisdictions might not have the money to support what they're being asked to do if they don't have the flexibility over the fees?
Thank you, Madam Chair. I would just point out two things. The first is that these are not the only such fees that are collected by local governments. There are other fees that are related to this process, including things like plan review, which are not limited by the statute. This was simply the first part, which was the license itself. And these fees are, for the most part, consistent with what we've heard are fees for farm-related business activities for food in other kinds of arrangements as well. So we were trying to keep these in line with the kinds of fees that farms have, recognizing that farms are, in fact, special entities that in many cases are smaller and have fewer resources.
Okay, before I open up to the members, I'd like to hear from Mecho and Mako if the accepting of most, if not all of these amendments is adequate for them to fully support this bill. Mako?
Thank you. Thank you, Madam Chair. And if Macho is on, they're welcome to go first, but if not, I'll go ahead. So yes, we really appreciate the department working with us. And I think we're comfortable with them. We are comfortable with them keeping the fee cap. We really appreciate them working with us on the other amendments.
Great. Thank you so much, Mecho. Is anyone here? Oh, seeing no one. Members, do you have any questions, concerns that you would like to raise at this time about this bill? Hearing none. Okay. All right, can I have a motion on the amendments?
Motion on the amendment.
Can I have a second?
Second.
Okay. Chris, can we just do a voice vote or a show of hands, or we don't need to? Let's do a show. Let's do a raise let's do your auto hand or your physical hand if you can't get to it. So all in favor of the amendments, raise your hand, please. Raise them, raise them, raise them. Okay. I see everything. Okay, lower your hands. Anybody opposed? Okay, so seeing no one in opposition, the amendments pass unanimously. Oh, I'm sorry, anybody in neutral? No, okay, because I can do my math. All right, what about moving the bill as amended?
So move.
And I think that was Delegate Kaufman and Delegate Hutchinson gave a second. So all in favor of the bill as amended, show of hands, please. All right, that looks like everybody. Hands down. Anyone in opposition? Anyone neutral? All right, that's unanimous. Okay, thank you all very much. Let's go on to the second bill, which is also, this is state emergency. This is House Bill 276. Lindsay, this is yours also. Could you go ahead and talk to us about this bill?
Thank you. This is a departmental bill from MIMS that alters the Public Access Automated External Defibrillator Program, also known as an AED, by clarifying which entities are required to participate in the program, exempting a law enforcement agency from obtaining a certificate for an AED deployed in a patrol vehicle, codifying the role of an AED coordinator, and establishing specified requirements for the coordinator, repealing obsolete provisions related to regional councils and regional council AED committees, and making conforming and clarifying changes. I circulated a reprint with amendments from MIMS. These are consensus amendments that establish that for a grocery store or restaurant to qualify for and retain a certificate, the entity only needs to register the name of the entity with the program and maintain the functionality of each AED and related equipment and supplies with FDA standards.
Okay, thank you so much. And I think those amendments were discussed during the bill hearing. So let's hear from the department on HB 276, please.
Good afternoon, Madam Chair. Christian Mealy from MIMS. So yes, as we discussed during the bill hearing, we are seeking to basically streamline the bill, clarify some definitions, make the bill a bit easier to understand. as I mentioned in my testimony, the public access AED program was established in 1999, and there's been a little bit of evolution in sort of the way that these programs have evolved in other states. And we kind of did a deep dive into what all 50 states do. What we realized is not every state does it, or every state does it differently in terms of which entities are required to have them and which ones aren't. Prior to my joining the team here at MIMS, there was legislation that basically exempted restaurants and grocery stores from certain requirements. The reprint and the amendment just makes it clear that this bill does not intend to add any additional requirements to them, but to just honor the arrangement that the General Assembly adopted. I think it was 2 sessions ago, if I'm not mistaken. So yeah, other than that, happy to answer any questions about the bill, but the only, I guess, one of the substantive changes is just that a law enforcement vehicle that has an AED deployed in the vehicle would not need to get a valid certificate from the state EMS board because of the presumption that the first responder would be well versed in how to use the AED.
Very good. Thank you, Mr. Thompson. You're representing the Restaurant Association, is that correct? And retailers?
Thank you, Madam Chair. Yes, Melvin Thompson representing the Restaurant Association, and we appreciate that MIMS did reach out to us early. We worked with them on these amendments, and we're fine with the bill as it was amended.
Wonderful. Thank you. Is there anyone for the retailers here? Okay, but my understanding, Christian, is that they're fine with the amendments in the bill as it is. Is that correct?
Yes, we got written confirmation, Madam Chair, from both organizations.
Okay, members, any questions, concerns that you want to raise? All right, can we have a motion on the amendments?
Motion on the amendment.
Second.
Thank you. All right, that's Delegate Hutchinson and Delegate Riley did the second. Can we have a vote, hands, either hands, any hands? All okay with the amendments? I see 1, 2, 3, 4, 5 members with hands up. Okay, just to go through the motions, anybody opposed? And I see Delegate Austin is here. Delegate Austin, we're voting on House Bill 276, some amendments that were consensus amendments that were discussed during the hearing and bring the Restaurant Association and Retailers Association aboard with this bill. So we just voted the amendments. We hadn't done the count. Did you want to be neutral against the amendments or want to support them, or you just like not to vote on the amendments since you haven't had in case you haven't had a chance to review them?
I'm fine with the amendments.
Great, thank you. Can I get a motion on the bill as amended?
So move.
Any seconds?
Second.
Second as amended, yeah.
Thank you very much. Let's go ahead. That was Kaufman and the Hutchinson Riley second, and you guys can fight over it. Let's go ahead and take the count. Show of whatever hand is available to you. All in favor of the bill as amendment? There's a bunch of ayes. I see Riley, Hill, Kaufman, Hutchinson, and Austin and Warman, and that leaves nobody to be in opposition or neutral, so that's unanimous. Thank you very much.
Thanks for your
Thank you all for
consideration.
your time. Lindsay, thank you for the work on this bill. Appreciate it. Okay, Chris, we're going to move on. Can we please go first to Delegate Gazzoni's bill, House Bill 427? The Task Force for Responsible Use of Natural Psychedelic Substances. My understanding is there was no opposition in the hearing. There are no amendments. There's no fiscal impact. And Delegate Gazzoni, did you want to speak to this bill?
Nope, just wanted to make sure nobody had any questions.
All right, any questions, members? You know, don't all speak at once. All right. Can I get a motion on the bill? Chris, I'm sorry. Can you describe the bill? My bad.
That's fine. This bill extends the task force on responsible use of natural psychedelic substances for an additional year and requires the task force to submit an updated report of its findings and recommendations to the Governor and the General Assembly by October 31st of this year. That's it.
All right, thank you. So hearing no questions, no one of the guests have anything to offer. We have no witnesses in opposition. Can I have a motion on the bill?
Motion on the bill.
Second.
All right, Riley and Austin, all in favor of the bill?
Aye.
Raise your hand or say aye. And all both, I've got Riley, Kaufman, Hutchinson, Austin, and Warman and Hill. Okay, so that's unanimous. We're moving right along at a rigorous pace here. So let's go ahead and order. We'll do 181, 316, 410. So House Bill 181. Chris, talk to us about this bill, please.
This bill requires a restaurant to offer a written disclosure of each major food allergen, and I'll explain why later, that a restaurant knows or reasonably should know is contained as an ingredient in each menu item. Disclosure must use the common names of the main food allergen or standardized pictograms. The disclosure may be written on the menu, available in a digital format, such as a QR code, a separate allergen-specific menu, an allergen chart, grid, or booklet, or any other written material. The bill does not apply to prepackaged foods that are subject to federal labeling requirements for main food allergens. A restaurant that violates the bill's requirement is subject to existing civil and criminal penalty provisions for food establishments. We do have an amendment from Delegate Woods to include Delegate Foley as a co-sponsor to change main food allergens to major food allergens, because main food allergens is a federal definition. And because of that, we've taken out the reference to the federal regulation and included a list of major food allergens: crustacean, shellfish, egg, fish, milk, peanuts, sesame, soybeans, tree nuts, and wheat, and any ingredient that contains a protein derived from those things.
Okay, thank you. All right, we're going to let Delegate Woods has staff here, and my summary of the bill hearing was that there were a number of folks, so there has no fiscal impact, there was no cross-file, there was some concern about costs to the restaurants themselves, a lot of discussion about ways to deal with that. MedCai had supports allergen disclosure requirements, but with a different mechanism than the criminal penalties. Seven Sister Restaurant had some issues, reasonably should know. Again, so I'm going to ask the sponsor if you'd like to speak to the bill and what work you've done since the bill hearing to try and address the offered amendments and the concerns that were raised during the hearing.
Thank you, Chair Hill. Really appreciate it, and members of the subcommittee. So we've had conversations with the Restaurant Association of Maryland in regard to the concerns that they have with the bill. And they've expressed that they wanted us to change the definition of restaurants to food service facilities, and also to limit the scope to establishments who have 20 or more nationwide. And we also had conversations in regards to the liability. Currently, in the bill, it has civil and criminal penalties, but that's what the state of Maryland has in place. So we are following the code that's already in place. We didn't establish something different.
Okay, so have you agreed to take any of the amendments that were requested, or you're just still in conversation?
We're still in conversation. We haven't decided to take any of the amendments that the Restaurant Association brought to our office. And the reason for that is because when they sent us the data that they had, if we were to limit the scope to establishments who had only 20 or more nationwide, that would just account for 4,000 out of the 11,000 in the entire state. And that's not even up to 50%.
Okay, all right, thank you. Okay, let me go ahead and open it up to anyone from the Restaurant Association or any other stakeholders on this bill, and then we'll let the members ask their questions.
Thank you very much, Madam Chair. Melvin Thompson, representing the Restaurant Association of Maryland. We have had conversations with the bill sponsor's office. We did share with them our draft amendments, which would change the bill language from restaurant to food service facility. And we did that because, as the fiscal note mentions, restaurant is not defined in the Health General article for Maryland. Food service facility is the term that's used, and so we think changing the language to food service facility would be consistent with Maryland's Health General article. And we're also proposing narrowing the scope, as was mentioned, to restaurants that have 20 or more locations. This would be restaurants and similar retail food establishments that are already subject to the federal menu labeling law. And the reason we did that is because these are the establishments that already must comply with disclosing nutrition information. And we believe that it's easier for them than an independent restaurant to comply with food allergen disclosures as well. California passed a similar law last year, and they also narrowed the scope to restaurants and similar retail food establishments that have 20 locations or more, consistent with the federal menu labeling law. And the reason, as we explained at the hearing, is because this will be very challenging for independent restaurants to maintain the updated disclosures required by this bill, given the uncertainty of their supply chain. Oftentimes, ingredients are substituted, and they just don't have the staff to keep the information updated the way this bill
All
requires.
right, thank you, Mr. Thompson. I don't want to re-adjudicate the whole
Sure.
bill. Okay, are there other stakeholders that had amendments that they want to offer that would like to speak right now? I see none. All right, Ms. Jordan, go ahead.
Yes, does it have to be an amendment, or can I share some stakeholder thoughts about amendments that have been proposed?
Go ahead, and you're representing?
I represent the Asthma and Allergy Foundation of America. We actually were the co-sponsors of the bill out
So at this point,
California.
because the sponsor has already addressed, you're for the bill, correct? You're for the bill?
Yes.
Okay, so unless there are specific questions.
That's correct, yes.
Yeah, but thank you for asking. All right, members. Delegate Riley, and then Delegate Hutchinson.
Thank you, Madam Chair. Yeah, I did have a couple other questions, especially if it's not limited in the size. And that would be, so this then would also include like small restaurants, individual small businesses. They don't necessarily, a lot of their chefs are not chefs, they're cooks. And they may not know every particular ingredient that would be an allergen. First of all, or the restaurant would have to hire like a nutritionist or a specialist in allergies. So I think it's just going to be very difficult to have the small restaurants in this particular bill. Even when we were listening to the young ladies that were witnessing, I caught up one thing she said. So now she is a person who is allergic. She has a physician whom she sees, but yet she still did not know that the sauce that was on her sandwich was actually made from nuts. So I think it's just so broad that it would, be very difficult for like small restaurants, like I said, that aren't actually chefs, they're cooks, to follow this and then to have that, that fine. I just think it's, unfair the way that is particularly drafted. So I still have concerns.
Thank you. I'm going to let Ms. Jordan answer, but I'm going to go ahead and get Delegate Hutchinson's question as well in case they can be answered together. Go ahead, Delegate Hutchinson.
Well, not so much as a question, but since having the bill hearing, I did go back to a number of my smaller food service providers and mentioned the same concerns about, them trying to keep up with this would be very problematic, costly. They're not always, they're very small businesses, and we're putting a lot of burdens on small business here with this bill. I'm very favorable of the Restaurant Association's amendments to at least get started. If we get started and we address 4,000 of the 11,000, let's do something. But pushing this down to all the food service, providers, restaurants, be very problematic.
All right, Ms. Jordan.
Thank you. So to address the first concern about, the contents of the food and who's going to be trying to figure out what the ingredients in each of the menu items, I would just ask the committee today to reflect on how it currently works. So when I go into a restaurant as someone with a food allergy and those in our community who also face the same problem, we still have the legal right to know what's inside the food. So currently right now, you know, the mistake that was made, and I was the young lady who spoke about the basil pesto sandwich. The issues there, as I assumed that there was no nuts because I didn't see it on the menu. And I did not ask at the time if there were nuts in the menu item, but a lot of that concern could have been resolved if there had been labeling. That was the point of that anecdote. And I think in general, restaurants do have a, you know, the duty to care, which includes knowing what's in the food. So they already have this information. It's just a matter of posting it in a more, you know, public fashion. Now, I also want to talk quickly about the requirement for the 20 or more locations. Part of the reason that we had to do that in California was due to the size of the state. There are 80,000 restaurants in California, and we were the co-authors of that legislation out there in California. And we had to make that hard decision just because of the size of the state. We think that in Maryland, where, you know, with a much smaller number of restaurants in the state, we're going to be able to provide the care and the Department of Health's guidance in order to get this rolling out for more than just those big chains. And I just want to mention one more thing before I pass it back to you, Chairwoman, is that most of the chain restaurants already do this. So it's on their websites already. And so we don't see, as the Asthma and Allergy Foundation of America, this being a meaningful step forward for the public safety of people in Maryland with food allergies.
All right. Any other members? Hold up, Mr. Thompson, for 1 second, please. Any other members have anything? Because we're going to go on to some other bills. Ms. Alomo, what I'm hearing is that there are other aspects of the bill that you might be able to make adjustments to. For instance, have you all talked about, instead of a list, you know, we have symbols that restaurants use, not necessarily even chain restaurants, that talk about the spiciness, right? Mild, when they just put a pepper on there, right? Would that be, you know, looking at other alternatives besides listing? Are there alternatives that you can look at with your stakeholders and discuss with the small business community, particularly in terms of what might be more reasonable expectations that they can do? Because you know, I think that there are issues that seems like you ought to be able to work out, short of just making the big restaurants do it and not the small ones. So if you haven't had those discussions, are those discussions you're willing to have?
Yes, we've had conversations about disclosure, and we did specify they do not have to list everything out on their menu. They can use a QR code, they can use a chart, they can have a poster at the front of their
I think
door.
there's some changes in the way the bill is written, though.
Okay.
That needs to be looked at. And then I'm gonna let Mr. Thompson.
Let me know about it.
I think this bill's not ready. I think there's a sense of this committee, even with both Delegate Rowley and Hutchinson, that something, maybe small, something should be done, right, to improve the system we have now. But I don't think it's been worked out, and I would really ask you to let Delegate Wilson know that I think a little bit more work needs to be done to get this ready.
Okay.
We'll be happy to bring it back next year. I mean, next week. Okay, and see where you
Thank
go with
you.
those discussions. Mr. Thompson, do you have one more thing you wanted to add?
Yes, very quickly, and thank you, Madam Chair. We will continue those discussions with the bill sponsor's office, but I just wanted to let the committee know the way it works now in restaurants. A customer notifies the restaurant if they have a food allergy, and then the restaurant makes the accommodation in the kitchen to make sure that the preparation and delivery of that food is safe for that customer. We're concerned that the disclosure on a menu might create a false sense of security where the conversation doesn't happen to ensure that the restaurant can accommodate.
And it might be that if the bill moves forward, there have to be specifications in the law that the customer is still obligated to disclose allergies, that it does not remove them from that obligation. And I don't think that's in the bill. So that may be another thing that you all can think about. Members, anything else? If not, we're going to move on to our next bill. Okay, thank you. Let's go on to Delegate Coffin. I'm going to hold on yours. Let's go on to 410. Actually, let's do Delegate Coffins, and can someone, I'm going to have my staff notify the sponsor of 410. And Delegate Coffin, I'm going to give you about 5 minutes on this bill because we're tight on time, and then we'll do Delegate Boyce's bill. So, Chris, can you discuss 316?
Sure.
bring us up to date with that?
This bill alters the definition of medical record regarding provisions governing the confidentiality of medical records by specifying that a medical record means any information that is recorded by a healthcare provider through written, electronic, or other means, including audio or video means, and includes any electronic message sent or received by a healthcare provider that identifies or may readily be associated with the identity of a patient. We do have an amendment from Delegate Kaufman to, one second, excuse me, to include transcription in the definition of confidential medical record. And we also have an amendment to amend subsection 5 to say electronic message sent or received by a healthcare provider, specifically regarding the diagnosis, treatment, or care of a patient. So. I think you're muted, Madam Chair.
That was all of it?
That's all.
Amendments. Okay. Delegate Kaufman, can you talk to us about the work you've been doing and where the amendments that you're offering came from?
Yes. Well, the amendments that I'm offering came directly from our discussions, Madam Chair, that the bill was too broad and captured more than I wanted it to. So that's why I say specifically it has to deal with patient care and things specifically related to a patient, because there was some talk about, well, would security footage have to be included? And the answer is absolutely not. Then in terms of, and then also in terms of, as I said, we've also done an amendment to try and accommodate Kaiser Permanente to allow them to engage in transcription. But I have to say, mostly, Madam Chair, I've heard crickets from the opponents of this legislation. And if I just could have 2 more seconds, I have in the packet that I sent you, email that I sent you all at 4:51 yesterday, direct responses to the questions raised by Delegate Hutchinson. It require asking for real world examples, including a litigation involving the Baltimore Medical Center. It's public, so I was able to do that. And I also have direct responses to the nominal cost, $7 a year for retaining the text messages and how little memory the text messages take up. So I think that from my point of view, and my door is always open, and I'm willing to amend it and twist it and turn it. But from my point of view, I'm willing to make more accommodations and different things. But from my point of view, I have already done extensive collaboration and to try to address concerns, and I'm willing to do more.
All right, thank you. I'm going to ask Jake to tell us what you guys have been offering, what kind of amendments you're offering.
Yeah, so thank you, Madam Chair. I'm here on behalf of Maryland's hospitals and health systems, here to respectfully oppose House Bill 316. We still think, even with the amendments, if this bill were to pass, Maryland would literally have the broadest definition of a medical record in the entire country. And I think what's most concerning about this bill is that it would create a chilling effect on care. So even if we limited this bill further to just intra-hospital messaging, it would change how providers really communicate with one another. So if every informal message becomes a part of the patient's record, providers will hesitate to consult with one another, talk to each other because of fear of liability and getting sued. And frankly, I really don't think this is hypothetical, because the main proponents for this bill are the trial attorneys. Additionally, as I mentioned, even as amended, I think this bill would still flood the medical record. It would still include data like hallway footage that clearly has no clinical value. And it would just hide critical information like life-saving information like allergies or treatment conflicts. And then finally, we were able to consult with our hospital IT, medical record, and clinical experts who had reviewed this bill, and they said, even with this definition, it's so broad and ambiguous that they'd have trouble operationalizing it. And I think most importantly, standardizing that operation across providers. So as an industry, we've been working for years to kind of standardize these different definitions so that we could transfer patients more effectively. And we feel like this would kind of restart that process. So for those reasons, we respectfully oppose and do not have any amendments at this time. Thank
All
you.
right, so just so I'm clear, you said it's too broad, but you, as the experts with the IT personnel, have no amendments on how to make it more narrow.
We do not have any amendments. We received the amendments from the sponsor during this
But you
hearing.
haven't offered any, correct?
We have not offered it. We
So
are
you
fine.
don't have a definition that you want to offer, but you say that this one's too broad. Okay, thank you. Ms. Taylor?
Hey there. Yeah, I do appreciate, I had some back and forth with the sponsor's office about this bill. Our issue, I think, was totally separate from the purpose of this bill, which was related to our use of ambient listening technology and a transcription service. The amendment as drafted, I think it actually it creates more breadth rather than narrowing, which I think was their intent. So the amendment as drafted it does not address the issue that we have.
Thank you. Delegate Hutchinson.
Thank you, Madam Chair. So I still sit here today and I don't understand what is the problem that we're trying to solve here with this bill. I find it to be incredibly broad, burdensome to our hospitals. And again, since we've heard the bill hearing, I have reached out to a number of physicians and medical care providers about this, and they say this would stymie creativity, this would stymie a lot of collaboration if all of this was to be collected and documented. So I say that this is not good for quality healthcare in Maryland, and this is not good for lowering the cost of care in the state of Maryland if we were to move forward.
All right, thank you, Delegate Austin.
Thank you, Madam Chair. I was actually just about to text you. I've been called to Ways and Means for a bill hearing that I have to sit in for our main committee on. But I was just wondering, can we hold this bill? I didn't know if you were planning to vote it or hold it.
We're not gonna vote on it. We're gonna hold it. I wanted to see if members had any other concerns or thoughts or questions that you wanted to have I wanted Delegate Kaufman to get a sense of where we are with the bill, and I wanted us to get a sense of where he is with the bill. All right, thank you. Good luck with well, you're not presenting, you're just listening. Okay, all right, thank you. Okay, Delegate Kaufman, Delegate Rowley, did you have your hand up?
Yes. I too have to go to Ways and Means. They just called, so I'm going to have to leave as well. So you're going to hold this bill, correct?
Yep. So we're going to hold this bill. We're going to briefly discuss Delegate Boyce's bill over the next 5-6 minutes, and then we're going to break so we can get to committee ourselves.
Okay. Thank you.
Thank you, Delegate Kaufman. Thank you very much. We'll talk, but I think clearly the sense of the subcommittee is that this needs some more work. And I understand you're saying that the opposition does not seem to be in much of a mood to work with you. We're gonna, I think one of the commitments that I'm making is that when we have good bills that need work, we're going to do everything we can to not let opposition just run out the clock. So we'll try to make sure that if the bill passes, it's in good shape. If the bill doesn't pass, it's not because a game was played to just run the clock out.
Thank you, Madam Chair.
All right, thank you. All right, so we have Representing Delegate Boyce on House Bill 410. Tell us, we're going to come to you in a second. Your name still says Office of Delegate Boyce, but I'm going to let Chris talk about House Bill 410, our counsel.
Thank you, Madam Chair. This bill establishes new requirements regarding labeling of food items and milk products for human consumption and prohibits the sale of items labeled with a sell-by date that do not meet such requirements. Beginning July 1st, 2027, a food manufacturer, processor, or retailer in a grade A milk plant or processor must use specified phrasing to indicate a quality date or a safety date on any food item offered for sale. The bill's food labeling provisions do not apply to infant formula or beer or other malt beverages. And by July 1st, 2027, MDH must create and post on the department's website educational materials to inform consumers about the meaning of quality and safety dates and adopt regulations to carry out the bill.
All right, thank you. Delegate Boyce's office.
Good afternoon, everyone. My name is Meredith Riley. I'm Delegate Boyce's legislative aide. Happy to be on here today to speak further to the bill. I do you want testimony? I'm happy
So I
to be
guess,
here and
I'm
answer
sorry, let me
questions.
interrupt. So can you tell us what work, if any, you've been able to do since the hearing? And if I know there was a fiscal impact of 125,000, which is a little bit outside of our limit. There were questions raised during the hearing about removing the supplements from it. And I think the delegate had mentioned that because FDA regulated items are not included, supplements are automatically not in the bill. And then there was issues about how this was going to be handled financially at the retail level. And there were issues about what was meant by the milk exclusion, the grade A dairy product exclusion. So if you're able to address any of those, or at least tell us what work you've done with the other stakeholders since the hearing, to be clear. Thank you.
Sure, thank you, thank you. So since the hearing, I know there were questions in the hearing about the educational component of the bill. In addition to streamlining and standardizing the food labeling laws, also would stand up an educational campaign through the Maryland Department of Health. We've reached out to them. Unfortunately, I have not heard back yet from them about the bill, but I'm hopeful that with time and attention, we can address any concerns related to that portion of the bill. There were also questions in the hearing about how this bill would work with the Maryland Food Bank. I reached out to the food bank, or the office reached out to the food bank after the hearing to gather their feedback. And I actually met with someone from the food bank yesterday who shared some feedback with me. Let me pull it up. I'm sorry, forgive the delay. So they shared with me that they have their own standards for intake for donations. They don't have any public facing or publicly available guidance that they use. They use mostly manufacturer and retailer guidance. That being said, the issue of taking in the food for donations for them is sort of complex. If they get unclear labeling, something is out of the date range or they have questions about it, they kind of have to resort, like consumers do, to using the sniff test, the sight test to determine whether or not that food is able to be sent out to recipients. So those are a couple of things that we've done since the hearing. As far as other questions that came up in the hearing that I can answer now.
Okay, that's
Sorry,
fine.
go ahead.
Yeah, I'm going to let the health department speak. Megan Lynch is here for the health department. And then I guess the question, since you brought up the food bank, are you saying that the food bank they are able to distribute items even if they have a pass date label as we currently are labeling them, or what is in other words, there were questions during the hearing that said that if we did this, it would increase the donations to the food bank. And there were other folks who took the position that if we did this, it would decrease the donations to the food bank. Were they able to address whether that would go up or down?
I don't want to speak for the food bank, obviously. I would hope that they would be able to put this kind of testimony on record at a different time. But I think our understanding is that there will still be food that expires and goes bad. And so my understanding is that this would not significantly impact food bank operations.
Okay, thank you. So I'm going to let Megan Lynch for MDH speak, and then we're going to, so we got about 2 minutes, and then we're going to go ahead and adjourn, and we'll carry this bill over to next week.
Sure.
Thank you.
And good afternoon, Chair. Thank you. I'll be super brief, and I'll follow up with the committee with a letter kind of laying out our concerns. But I think folks can understand that this is going to require a good deal of resources from the department, and we don't have the highly specialized subject matter expertise or really the staffing capacity to really undertake what we view as a very resource intensive process of determining the best practices for food labeling. And I think we would point to California, right? And just thinking about the implementation dates of the bill. I think California had about 2 years to ramp up to speed, and Maryland businesses would have a lot less time. And surely the department as well would have a lot less time to develop regulations. I think we understand the spirit and the intent of the bill, right? I think, we feel this way about many things, but I think the educational program and putting that on the department is just not something we can absorb right now.
So I want to be clear. Are you saying that your problem is with the education mandate? That's where the manpower issue is, and coming up with regulations on a short ramp up. So
That's
that if the
correct.
date were pushed out and the education piece were removed, the department might come back either neutral or in support. Are those the two issues?
I think we could certainly have a different conversation. Yep, absolutely.
Okay. All right, members that are still here, do you all have any other things you want to raise that can be taken back to the sponsor? Okay. All right, thank you very much. So we'll bring this bill back next week. So hopefully this has given you some direction, and you can work on making the changes, even if that will help us get this across the line. Okay. All right, thank you. I've got Shauna Hindley is representing who?
Hi, I'm with the University of Maryland Extension, but not necessarily representing all of the university. Yeah.
Okay, and you were speaking on this bill or another bill?
On this one.
Okay, did you have any
If
comments?
needed.
Okay, did you have anything you wanted to add to the conversation?
I can add that Extension is all about outreach and education, so we might be able to partner with MDH for the outreach and education. That's something I'm very familiar with. Successful campaigns include my dissertation with Don't Wash Your Chicken. We also had one for farm worker training, the produce trainer, and Wash Your Produce, which helped at farmers markets, and WIC featured it in their summer magazine in 2017. So happy to work with MDH.
Fabulous. All right. Well, hopefully the sponsor will reach out to you and MDH and see what you guys are able to come to. Appreciate it. All right. Thank you. With that, I would entertain a motion, and thank you for coming, all of you. I will entertain a motion to adjourn.
Motion to adjourn.
Nobody apparently is second. I'm going to second. I don't know if I can. Delegate Borman.
Second.
You going to second?
Second.
All right. See you guys in a few. All right. Thank you very much. Thank you, Chris.